So I know it's a bit of a different podcast to the normal podcast we'll be doing, but this is going to be an interesting one. I think hopefully very useful for people watching. I'm Dr. Max Draper, lead clinician at Alphagenix, and I'm delighted to be welcomed by an expert patient, I think, Roger Snipes. And we're going to be looking through his blood work and reviewing, seeing what can be advised on it, or seeing what looks good and if there's anything that needs adjustment. But Roger, thank you very much for agreeing to do this. It's going to be useful, I think, to a lot of your audience and our audience as well.
Thank you. Thank you very much, Dr. Max. I appreciate the opportunity to go through it. I think blood work is really important. I'd always done blood work, but not as consistent as I am right now. And as a little backstory, I've been into health and fitness most of my life, over 30 years. So since school. And so I used to sprint as a kid and then slowly moved into bodybuilding, the whole aesthetic appeal and, the videotape era, which is scarce now. More influencer type of people are around who are sharing their views on bodybuilding. But yeah, as I approached my mid-30s, I started to become more interested in optimal health and follow, I guess, the popular term biohacking, which people are using these days. So finding ways in which I can focus on strengthening my mitochondria and focusing on health span as well as lifespan. And in late 24, November 24, I was struck down with some pain and ended up in hospital. So it was a bit of a surprise for me, especially since I never get sick. I don't even get the flu. So the pain was really intense. When I was in hospital, they suggested to do an ultrasound. And I was like, well, that's a bit extreme. Surely I just need some antibiotics and I'll be on my way. In fact, I want to go to the gym later. That was my thought. Can we hurry this up, please?
Yeah.
So they continued with the scan, and when I was asked to sit aside whilst they go through the results, and then they pulled me to the side with the doctor, and they said, it looks like we found a tumor. And at the time, I was like, what do you mean, a tumor? It looks like a tumor. Okay, so it basically could be, it might not be. I was going more with the latter because I thought I never get sick. That's impossible. Further exams showed that it was, and they later learned that it was testicular cancer. So I had to go on chemotherapy. That was for a 9-week period. And they also discovered I had blood clots. And in fact, they were probably more concerned about the blood clots than the cancer, because they said it was more extreme where I could die immediately if something goes wrong. So, keep away from any sort of strenuous movement. And at the same time, don't sit around for too long. So, okay, don't move, don't sit. Right, what do I do? Most of my life I'd been training. So it was really difficult when I was in hospital, bedbound, and was not allowed to lift weights. Didn't have the energy to lift weights, let alone do it. But so I was in hospital for a bit, on chemo for 9 weeks, and was on blood thinners. And over a set period of time, we eventually, beat cancer. So I'm in all clear now. But when I came out of hospital, my hormones was affected. I didn't know immediately what it was, but I just felt weird symptoms. My energy was low, and I found that I was, my sleep was off, and periodically I would just start bursting in sweat, like cold sweats. And I was like, what, have I got a fever? What's wrong with me? I later discovered it was low testosterone, or the hospital called it hypogonadism. So this is where my body's ability to produce sperm and testosterone is greatly reduced. My blood work came back as 3.2 nanomoles, my testosterone. As we all know, we want it around the 20 range. Mine was 3.2. So that explained why I felt like a woman. I remember watching a cartoon and crying. I was like, why am I affected? Why am I affected by this cartoon? It's so sad. It was so strange for me. But yeah, they put me on testosterone, and then my test level slowly increased to a point where it's like it's been very optimal. So today is going to be very interesting to see where everything is at. You know, considering what I've been through, it would be good to know whether anything is affected or anything which I don't really focus on is affected, and what things are switched on, what things are switched off when you are taking testosterone. I think that will be interesting for some people as well.
Yeah, and I think it'd be before we obviously clicked record there, we spoke about you're taking testosterone, nothing sort of medication alongside it other than for the blood clots. So you're taking the rivaroxaban as the blood thinner. And I presume a lot of people watching this seeing the delts there popping. But how would you describe your lifestyle and diet and nutrition?
I think it's pretty good. I'm pretty stringent and regimented when it comes to nutrition. You know, before each meal, I always have digestive enzymes, sometimes hydrochloric acid. I won't always eat breakfast. I'm more intuitive when I'm eating, so I don't force myself to eat. I just eat if it feels right. It's mainly protein driven with lots of vegetables, and carbohydrates is sparing, depending how I feel. I have fruits periodically, but typically lots of vegetables. Grains periodically as well. I would always have a coffee. And in the coffee, I'd normally throw protein in there. Protein and some collagen, sometimes adaptogenic mushrooms like lion's mane, cordyceps, reishi. I'll have a little bit of MCT oil in there as well as fats and some butter. Sounds a bit random, but yeah, it gives me energy in the morning. I have some different forms of supplements, vitamin D3, K2, omega-3, magnesium. Those are probably the staples, and I have lots of other ones which I'll take on the odd occasion, like selenium and gosh, I'm trying to think now. Boron. Sometimes I'll have that frequently. Boron. What else?
Do you take creatine? Did you say creatine there in that list?
Actually, yeah. Sometimes I put it in my coffee. I think I watched a functional medicine doctor speak about putting it in their coffee. So yeah, sometimes I have it in my coffee, or I'll have it in a jug of water when I'm at the gym. 5 to 10 milligrams a day. Also, I have electrolytes.
Yeah,
all the time. Always have electrolytes. Yeah, and sometimes I'll have like some glutathione. I've got glutathione which I'll have every once in a while. Just trying to remember all this stuff, you know. I should have.
Yeah. Well, I've got similarly. I've got quite a few supplements here and there in the cupboard that sometimes I'll take them for a while. Sometimes I'll switch them over or something like that. Yeah. When you got your blood, I mean, when you've been through your health journey prior to obviously these blood work, has anybody ever highlighted a problem in the past? They've commented on X, Y, or Z being raised or low. If you see what I mean, previous blood work ever highlighted anything of concern or note?
there was maybe concern with liver,
Right.
or kidneys.
Mm-hmm.
Yeah, and I think with the kidneys, what is it? What's it called?
Raised
GFR.
creatine. GFR. Yeah.
Yeah, the GFR. I think the
Mm-hmm.
GFR was low, and the creatinine levels. What's quite interesting was when I came out the hospital, I started to go to the gym, and that's when the creatinine levels started to go up. That's because I
Mm-hmm.
started putting on muscle. I wasn't
Yeah.
even taking creatine
Mm-hmm.
immediately afterwards, but when it started to go up, the doctors had a concern, believing that it was my kidneys. And I was like, I don't understand,
Mm-hmm.
and they're the doctors, and you'd see it as they're the experts. But then when I started to look further in it, I realized, I was putting on some muscle because I was bedbound for so long. Now I'm training, and I'm actually eating food, and my body is, working with me. So yeah, so I didn't really have too much of a concern there.
Mm-hmm.
But yeah, liver, I think that had come up on some odd occasions. I can't remember what details it showed me on the liver, but that was something which had a slight concern. So I started to have like milk thistle and more glutathione, activated charcoal, chlorella, just saunas, to try and
Yeah.
detox as much as possible when I can.
Yeah. Did they ever mention that might have been post chemotherapy or anything like that? Sometimes these chemo agents can obviously have a bit of a knock-on effect on our organ systems, but
Mm.
just wonder.
Well, the kidney one was more recent,
Right.
and the liver one was like over a long time,
Okay.
like
Yeah.
at least 8 years.
Yeah. Yeah.
Yeah.
And blood work wise, that we've obviously got here with us today, that we'll stick on the screen shortly. Your recent lab work. What's useful to know as the doctor reviewing them is when you got them done. When you had them done, when was the last gym session? Do you recall how long before you had them done? Was it day before, 2 days before, time scale wise?
Oh, it could have been a couple of days.
Yeah, yeah. Normally the instructions come out and say avoid any heavy lifting for a couple of days prior. Yeah,
Yeah, and I think they said to avoid like sex for 48 hours or something like that.
yeah, yeah, yeah. Again, it
Yeah.
can skew a few of the blood results. Yeah,
Right.
yeah.
And what part of the blood results is affected besides? Does testosterone get affected? And also, is there anything else that does?
Yeah, I mean, if you're a natural, so if you're not on TRT, then in theory, intercourse or ejaculation can skew your testosterone levels slightly temporarily. It's usually quite a short and brief effect. It's actually more that it can elevate your prolactin level, which is one of the hormones that we look at when we're assessing, people's blood work, or it can skew, and this often sets off more anxiety, is it can skew your prostate marker, your PSA, up. So people can get their blood results back if they've not followed that sort of abstinence rule, and they can think, oh my god, I've got prostate cancer, and it's actually just simply because they had sex or they ejaculated a day before, maybe 2 days before, and their level of PSA goes up for a little bit afterwards, which is why we tend to say kind of avoid these things before the bloods, because otherwise it can make you look, or it can make it look like there's a problem when there might not necessarily be one. Yeah.
That's interesting. That's fascinating. It can show your PSA levels is higher.
Yeah. Yeah. Because
Ah,
your prostate is kind of involved in the ejaculation process. It contributes fluid. So it's almost like you're using the prostate in that thing. So it happens all the time with my
right.
patients. Yeah. Especially when, as you know yourself, if you've got a healthy, robust libido, then you don't always follow that rule per se. So that could happen fairly often. Yeah, yeah. It's probably one of the biggest ones people don't follow, I would say. Yeah, yeah.
I might have failed there. I don't know. I can't remember, to be honest.
I think you're all right. I think you're all right. I think. Yeah.
Right. Okay.
Yeah. So this is your latest lab results. Obviously, they were done quite recently. It was 10 days ago now, wasn't it? And we can see very firstly on the top there, this is your HbA1c. So effectively, I'll just run through them with you, Roger, if you're happy with that, and we can kind of pick up things that are slightly out of line or whether they're worrying or not really. And I don't think there's anything on here, to be honest, that was particularly concerning. HbA1c. So that basically, I like to use that as a kind of describe it like this is kind of telling us how good your sugar control's been in the lead up to the blood work. So in theory, it's kind of looking back over up to about 90 days prior to the blood work. So HbA1c is the classic test that people will get diagnosed with being diabetic or pre-diabetic. That's what you tend to use an HbA1c for. You can see your level was 35, which would be considered very reasonable. We essentially, at the very least, want to keep it away from 42. So 42 and above is pre-diabetes. So if I see a 35, I generally consider it to be very reasonable result. Decent reading, essentially. Yeah.
Okay. What's an optimal reading?
I tend to say 35 or below, essentially. Okay. Yeah. So by a 35 reading, I'm pretty happy with that. I mean, do you think the other thing that we'll go into with the blood work is obviously with it being January, do you think your December period, festive period, was different to your normal run-of-the-mill month, if you see what I mean? Were you eating more? Were you a little bit more sort of less strict dietary-wise? Any changes there, obviously, with the Christmas festive period?
Probably a bit more food. But it's interesting because I wouldn't eat anything I wouldn't typically eat anyway, to be fair.
Right.
Still pretty healthy. I didn't even think I had any cake. I got cake for like family, but I was like, yeah, this ain't for me. Do you know what I mean?
Yeah.
I don't drink alcohol. Yeah, maybe just a bit more food and less active. That was probably it. Whereas normally if I'm eating food, I make sure that I'm active with it. So blood sugar levels could have gone up because of less activity. I still went on some walks, but I wasn't as physically active. That's probably it.
Yeah. I mean, I think ultimately 35 would be considered what I would describe as the top of the optimal range, if you see what I mean. And I suppose if you appreciate that it's just coming off the festive period, maybe if you're eating more, doing a little bit less than usual, it probably is consistently normally slightly better than that. That's what we've got to always factor in, particularly in January blood work, to be honest. They often do tend to be a little bit skewed compared to baseline. And then you've got your creatinine kinase here. So what that enzyme, that's basically a way to think about creatinine kinase is it's an enzyme released by your muscle when your muscle breaks down. So this is very common to see in folks like yourself when you are regularly hitting the gym. So it's essentially going to be elevated, probably unless you took a good week of rest from the gym, maybe 5 days, but it can stay elevated, particularly after weightlifting, particularly heavy weightlifting, for a good several days post gym session. That's why I was always checking, when was the last time you went as such? Does that make sense?
Right. Yeah. So what is a typical range, or not just a typical, but what is the general range which is considered as okay, and what is considered as not okay, and what are some factors to look at?
It's all essentially determined by really timing of the test versus when you trained and how heavy you trained. So for example, if you go to the gym and you do a heavy leg day, and I've seen results in 1,000 or plus post leg day, particularly if it's a heavy one. So it's really more context. there's not really necessarily a level at which you could say an athlete will have a different baseline marker level, if that makes sense. So
Mm,
it's all about context, which is why the sort of context matters when you're looking at blood work here. Yeah.
okay. What does mine say there?
386. So just, 66 over normal, very normal for someone like yourself who's regularly lifting weights, though. Yeah.
Mm, okay. 40 to 320. Right, right.
And then
And
you've
with
got,
creatinine, what's its duty in the body?
it's essentially a breakdown product of muscle breakdown.
Hmm.
So essentially, when your muscle fibers break, they release it into the bloodstream as a way to think about it. It used to be used to detect heart attacks because it's also released by heart muscle. Now, the issue with it is that it's also released by skeletal muscle. So when you go to the gym, you are going to get an elevated level in the blood as if you've done anything reasonable in the gym, essentially.
Mm. So why is it still being used if there's going to be things that can skew the results?
It doesn't get used so much for heart attacks anymore. It's more they use something called a troponin, which is more specific to the heart muscle. Yeah.
Hmm. But we do have a creatinine test within blood work all the time, though, isn't it?
Yeah.
What's it used for?
Well, this one is to essentially it's more to determine whether someone doesn't have a muscular disorder. So if
Okay.
you had a week off the gym and you weren't a regular lifter, let's say, so you're a standard member of society who wasn't going to the gym regularly, and you had a raised creatinine kinase, you would start to wonder, is there a problem with this chap's muscles? And there can be genetic disorders, there can be adult onset disorders that can cause muscle breakdown inappropriately, and that can be determined or picked up or at least alluded to from the blood work. Yeah.
Right. Cool. Okay. Sweet.
And
All
then
right. What else?
you've got your iron, and just below the cholesterol you should be able to see your ferritin reading in just below the cholesterol results. Ferritin there 50, that's your iron stores, is one way to think about it. And your total iron in the bloodstream was 23.9. So essentially what that tells us is we don't have an iron deficiency issue.
Right.
um, Very reasonable iron numbers for men. For us blokes, it's unusual if we do develop an iron deficiency unless we're kind of really avoiding any iron containing foods. So if you do get an iron deficiency as a bloke, because we don't bleed monthly, it's worth thinking about or getting investigated as to why that would be, because we're not losing iron on a regular basis like women are. So your
Hmm.
iron levels were absolutely hunky dory there. Yeah.
Sweet. Sweet.
And then cholesterol is, I would say, cholesterol is a 4 out of 5 very good results. You've got one that's slightly out, if that makes sense.
Hmm.
So I always say to people, don't pay too much attention to the total cholesterol, which is that 5.59 there. What you actually want to look at is the breakdown of the results. So, number one, what sticks out as a very good sign is your triglycerides are 0.77, which is essentially, think about the triglycerides as the fat in the blood. So, this is another marker that you have to be fasted for it to be useful, because if you've just eaten some, butter, eggs on toast, anything like that, anything with any fat in, it's going to register as triglycerides potentially in your blood work. And so it may make you look less healthy. So your triglycerides, optimum, we would say, for a fasted level of triglycerides is below 1. And essentially, if you've got low triglycerides in your bloodstream when you get tested, like your level 0.77, what it points to good metabolic health. It points to likely a proxy marker of less internal fat. So if you've got fat around your liver, fat around your organs, you'll often see in the blood work people's fasted triglycerides level is elevated. So I like to use it as a general health marker. So 0.77, excellent result. And then when you look at the breakdown in the cholesterol, you've got your HDL, your LDL, and your non-HDL cholesterol. And what stands out in your panel is you've got an excellent level of HDL cholesterol. It's higher than average. And online, there's a lot of toing and froing about cholesterol. They sort of say, it's not about cholesterol, it's about overall health. And to be fair, there probably is some truth to saying that we maybe have been guilty of fixating too much on cholesterol rather than looking at the overall health report. You've got a higher HDL than the average man, I would say, 1.94. HDL is the stuff that we generally like because we associate it with a good sign of overall health. And then LDL was 3.3, which, as you can see, has come in slightly over target, one would argue. Any obvious signs where you would think, my LDL might be a little bit raised because, is it the butter in the coffee? Is it anything you could think where it's particularly fat? Usually it correlates to some extent to fat intake.
It's hard to say because I have a long fast before I eat, but I do love fat, whether it's butter or coconut oil, nuts, seeds. Is there anything else that could raise it besides that? It's got nothing to do with like sugary stuff that can raise cholesterol. Is it only fat related?
So kind of tick off as well, there's genetic elements to this. So your genetics can influence your cholesterol baseline, your certainly your metabolic health. So how, sugary foods, particularly, so think about things like donuts, cakes, that sort of thing. I tend to say the first thing to do if you want to improve your cholesterol profile is reduce processed food. Obviously, it sounds like your diet is pretty, when we're speaking before, is pretty whole food based and healthy. So then you would think about, over Christmas, eating more calories, doing less exercise. That's probably has had a potential uptick effect on the LDL cholesterol, very likely. So that would be one aspect that we could consider to be, adding to this picture. But, to be honest with you, overall, with the HbA1c, so the sugar control 35, with the HDL and the triglycerides where they are, I wouldn't necessarily look at that LDL and say, you know what, Roger, you need to make, wholesale changes to anything overly dramatic. First port of call, because of the Christmas period and the changes, it may well be to say, right, well, you've got a healthy baseline in terms of your lifestyle. It may be worth just re-looking at this in 3 months to see what is it trending like for the rest of the year, and you can kind of adjudicate from there. Wouldn't shock me if it came in below 3, to be honest, on a normal run up to blood work.
Right. Okay, does
that make sense?
No, yeah, absolutely. I mean, my intake, I don't tip. Sometimes I find many other people eat a lot more than me. There's days when I'll eat a lot. I'm intuitive when I eat. I'm not one of those who eats 5 meals a day, 6 meals. I'll have 1 to 2. Sometimes you might have a lot of fat in there because I'm like, okay, I feel like I need fat. And sometimes it's just not that much.
Yeah, kind of doing what works for you in a sense. Yeah, I mean, like I said, from that overall profile as a general health picture, it wasn't jumping out at me as saying, oh, we need to really change something up here, Roger, because otherwise we'll be in trouble. It wasn't telling me that message really. Yeah. You've got your TSH, your free T3, and your free thyroxine there. So that's your thyroid panel. So that's telling us how well is Roger's thyroid system working. And to be fair, when you've had hormonal issues like testosterone problems, sometimes people can have either coexisting thyroid problems or thyroid issues can lead to testosterone problems. So that's something you really want to have a look at if you're worried about your testosterone, is your thyroid. Your thyroid panel, pretty tip top there. You can see there your TSH of 1, means that essentially your brain is very happy with what your thyroid is doing. And your T3 and your thyroxine levels, that's what your thyroid is putting out into the bloodstream. And the T3 is being created in the bloodstream and a little bit directly from the thyroid. So very, 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 very decent panel, I would say. Certainly not sticking out as a suboptimal picture, really.
Okay. So you got the free T3 and free thyroxine, which is FT4.
Yeah.
Okay. And what are the main differences between those both?
So thyroxine, so if you imagine T4, that's your thyroid gland predominantly produces T4 into the bloodstream, so thyroxine. But it's a bit of a weird system where actually the thyroxine is mostly not doing anything until it gets converted into T3. So you do produce a little bit T3 directly from your thyroid, but a lot of the T3 comes from the T4 being converted into it. So they're both important because T4, in a way, I suppose, tells you how much is the precursor is the thyroid making, and then the T3 levels in the bloodstream can hint at whether you've got enough of the active hormone. Because I like to think of T3 as the active thyroid hormone in a sense.
Yeah. And what would you say are good things, good measures, lifestyle measures to help with the thyroid?
Very much similar to testosterone in many aspects. So good, essentially all of our hormone systems respond to healthy living. So we want to be exercising regularly, getting enough sleep. Thyroid particularly gets impacted if people are in a prolonged deficit. So particularly if it's a heavy deficit, so they're not eating enough food for a prolonged period of time. That's where people can often refer to sort of dietary fatigue. Sometimes that can be the thyroid's really kind of pulling back because you're in a prolonged deficit. But generally the same with testosterone. Healthy lifestyle, plenty of exercise, plenty of whole foods, nutrition dense food rather than processed stuff, enough sleep. And probably with the thyroid, what we're probably missing nowadays is getting enough sunlight, because there is a role in terms of sun exposure, not just vitamin D, but in general, it's important for our thyroid systems. Seeing a lot of thyroid issues nowadays, more than we used to, because, well, potentially there's environmental factors in that as well, but it might just be people aren't seeing as much sunshine as they used to. Yeah.
Right. And what's a typical symptom of someone who has low thyroid? How would they know? We know with testosterone, you feel lethargic and almost mentally disorientated, hot flashes, you feel weaker, just fatigue, loads of things around that. What about low T3 and T4, FT4?
Lot of similar crossovers, to be honest. So probably the most common symptoms you'll come across will be fatigue, will be a lack of energy. Because the funny thing about the thyroid is it can even have a knock-on effect on your testosterone. So you can often end up having a bit of a double whammy. So fixing the thyroid can sometimes fix the testosterone. So that's why it's important to check for both. But main one is energy. A little bit like low testosterone as well, people can have body composition changes. So particularly thyroid, people will often think of they're gaining weight, like fat around their tummy, but they've not changed anything diet-wise and things. So inappropriate weight gain can be a factor. Mood, so lower mood, lower motivation, brain fog. That it can affect hair as well. So people can notice their hair's thinning, that sort of thing. But a lot of similar crossovers with testosterone, really, classically.
So you can't really tell then unless you do a test. You
Basically.
really can't. I don't know about the thinning if your testosterone is low. Is that a similar case with testosterone?
Not so commonly, no. I mean, usually the thinning on the top's from higher testosterone and your genetics, really. But low testosterone, people can find their body hair is thinning or their beard is not as good or growing as well. But that's not very common, really, to notice it. Yeah.
Right. Okay. So yeah, there could be similar things, and you don't even know. It could be thyroid or testosterone. And it's interesting what you say there, that if one is affecting the other, it could make sense to just fix the thyroid. You know,
Yeah.
people might decide, gonna jump on TRT because it's low. Bro, you need to sort out your thyroid. That's why. But they don't know,
Yeah.
right?
100%, 100%. And the thing about the thyroid as well is, you would argue, if you had two problems, say the thyroid and the testosterone, the thyroid is kind of like, fixing that is less invasive potentially than the testosterone, because like you and I know, it's like TRT injections often for life, whereas with the thyroid, it's tablets. It seems less, less invasive. You don't switch off your own system like you do necessarily with TRT. So yeah, thyroid would be, if you had to choose one, you'd choose to try the thyroid first and see if it fixed the testosterone. Yeah.
Mm, mm. So let's say someone's test comes back and it shows that both of them is low. How would you know that it's the thyroid that affected the testosterone? Let's say they didn't want to go on TRT.
Yeah.
Yeah. Yeah. How would you know what has affected the other? Is there any way of knowing?
Not 100% certainty. You can't with 100% certainty. There can be certain pictures in the blood work in terms of the signaling image that you're getting from the blood work. So you can see the TSH there. That's the signal from the brain to the thyroid. With the testosterone system, we have the signals from the brain to the testicles. And so that picture can sometimes tell you where the problem may be coming from, but it's not always clear cut if it's the thyroid driving the low T in that circumstance. So you have to try and sort of take the history and work out, right, which do we think, almost like chicken and egg, which one came first potentially. Sometimes the blood work does give you a hint of that, but it's about putting the piece of the puzzle together and then, almost making best educated guess that the thyroid might correct the testosterone. To be honest, if the thyroid is very out of line, it will almost always have a knock-on effect on the testosterone. So, it usually will at least help the testosterone level to some extent, to be fair.
Okay. Cool. So PSA levels looks okay.
Nice and low. Yeah, that's the one, like I was saying before, about avoiding the sexy times before the blood work for a couple of days, because otherwise you can get a falsely elevated result and it can make men scared they've got prostate disease or something like that. And then total protein down to bilirubin, that's your liver panel. So total protein down to bilirubin is telling you about essentially your liver in how it's functioning, whether it's irritated or anything on those lines. And that's the reason I was asking about historically, has there ever been anything picked up? Because you can see on your blood work, slightly raised alanine transferase and a slightly raised gamma GT. Now, those markers would classically point to a little bit of liver irritation rather than any failure or anything like that, or dysfunction in terms of it's still doing its job. It implies it's irritated. But I'll put one caveat in here, which is the alanine transferase, that enzyme, is not only released by the liver, it's also released by skeletal muscle. So with you training regularly, you can have a slightly elevated alanine transferase marker as a result of training regularly, because it's, again, like the creatinine kinase, it's coming from your muscle. The gamma GT stood out a little bit to me because that is not really usually affected by training or anything like that. So I wonder whether that's something that's been picked up historically, potentially following some of the treatment you had almost.
Ooh, I don't think that was one which was a big focus, to be fair. It was just always creatinine levels, creatinine.
Right.
That was the main one.
Yeah.
Yeah. I'd have to go back through the blood work to have a look at that, because it wasn't something that was perceived as alarming. I guess I just wrote it off because it weren't their concern. But that's really interesting.
Well, I think what we could do is we could always get a copy of the old set of labs and compare and contrast with these ones. I'm just going to check in the lead up to these bloods, Christmas time, any alcohol? I mean, you didn't mention any drinking or any alcohol or anything like that around.
Yeah, I don't drink alcohol. I stopped.
No.
It's been about 7 years that I don't drink it.
Yeah, fair enough. The reason I mentioned it is that gamma GT can be commonly elevated after alcohol, really. Yeah.
Okay.
Yeah.
And what is it exactly? What does it do?
So it's an enzyme that's released from the liver and so higher levels can imply there's been a bit of liver irritation. So you commonly think of things that can irritate the liver. So, like I said, alcohol, certain medications can do that. Fat around the liver can do this as well, but you wouldn't be the classic person to have fat around their liver, because that tends to be people who are more sedentary. They're carrying, you can see a lot of fat on their body, hence they've got internal fat. So be a bit unusual for you to have that. But I mean, worst case scenario, we could always organize an ultrasound of the liver to see if there's any evidence of irritation and why it may be present.
Yeah, maybe that might be an idea, because that's elevated. I'd like to know what's going on there.
Yeah, no, absolutely. Yeah. And none of your supplements or anything like that do it either when we went through them. So there's nothing in there that you'd expect to be causative.
What sort of supplements could potentially cause an issue?
Some supplements, not commonly taken. Some of the ones that essentially what they do is they use up some of the liver enzymes. So the enzymes in the liver, they're kind of like, you know how paracetamol, the reason that taking too much paracetamol damages the liver is you kind of deplete the liver of certain enzymes. And so essentially then it builds up and toxifies. Quite uncommon with certain, not very common with medications, with supplements, sorry, but medications more commonly. So classic ones would be like your statins, some of the antifungals, so stuff for thrush and things can irritate the liver. Some antibiotics can cause this sort of picture as well. But yeah, nothing you're taking on a regular basis, to be fair.
Okay. Cool. What else we got on here?
And then you've got your urea, your creatinine, and your estimated GFR. And exactly like you said before, elevated creatinine and slightly reduced eGFR. So like you pointed out before, a couple of things influence the creatinine level beyond just kidney function. So we use it as a marker of kidney function, but higher muscle mass can elevate the creatinine level, as can creatine supplementation. So taking creatine regularly will often increase the creatinine level to some extent. Plus, if you've got more muscle mass, you tend to have a higher creatinine baseline. And if your creatinine goes up, your estimated GFR goes down. Yeah. So I think in your case, what would be more important, one would argue, would be the trend, because we know you're a big, you've got good muscle mass. We know you take creatine. So rather than have one-off read, you'd want to trend it over time. So is it stable? In which case, we know it's just being influenced by the nature of your muscles, your creatine. If it's going down, then that would be like, hang on a minute, is this just the muscle and the creatine use? Does that make sense?
All right. Yeah. Okay. Yeah, I'd have to have a look through my other blood work to see where it's trending, but I think it has been roughly around 150. It might have gone down slightly. I'm not sure.
Yeah.
It's a weird one. Because I feel like over time, especially being on TRT, like my muscles have just been solid. Solid.
Yeah. Well, you're a well-built guy. Do you know what I mean in terms of, muscle mass there?
Yeah. Okay. It was ovulation. Yeah. How am I doing there?
Yeah, you're ovulating at the time of the test, I'm afraid. No. All good. So that's your hormonal profile there. How did you time your blood work in terms of your injections. Do you recall when you last jabbed and things in terms of the?
So I think the test was on, or the blood test was on the Friday, and the previous day would have been about 9:30 in the morning. Yeah.
And you reported you're feeling good. The testosterone's done the trick in terms of where you were with low testosterone to how you're feeling now. So would you say things are kind of going well from a TRT perspective?
Yeah, pretty amazing.
Yeah.
I feel great. I feel great.
Yeah.
I feel energetic in the morning. Morning wood.
Yeah.
You can get it throughout the night. It's just, feeling good, feeling solid, focused.
Yeah.
I don't feel fatigue. I mean, I guess general fatigue, like if I'm training quite intensely, sometimes I'm like, okay, you need to take a few days off, just rest the body now. But but other than that, mental agility, everything feels good.
Yeah. Lovely. Yeah. But I think when it comes to TRT, so much of it comes down to symptoms. So how are you feeling? How are you responding to the treatment? Are things feeling steady, stable, and good in general? So we kind of look at the blood work as are we way out in terms of like crazy high or just lower than you would want to be in terms of optimal health? So the blood work in that sense is really a kind of, you'd say a guide, but the symptoms are really telling us, is it doing its job? Is it working? Are we happy with where we're at? So if you look at that profile there, overall, you'd say that's a very nice looking picture when it comes to a bloke on TRT. And the feedback from you is probably arguably more important because it's doing what we're hoping it to do, if you see what I mean. So if you came to me with that report and said, feeling good, everything's going well, the testosterone levels, in a sense, would really just be like saying we're not way out of bounds here either direction. And 29, free testosterone of 0.54 effectively, prolactin nice and normal, looks good picture, good, healthy, optimal picture, you would say that is there.
Awesome. I've always thought to myself, is it always great to have like low SHBG? Is there a point where it's like, okay, this is too low? Obviously, you got the numbers from 18.3 to 54.1.
Yeah.
Are there any disadvantages if I was to have it down to, let's say, 30? Or would it just be, okay, this is amazing? Like, is there a disadvantage of having, much lower? Is there a risk?
Yeah, not so. Essentially, it depends on how you look at SHBG. So people will call it a binding protein or a transporter protein. Now, if you went from 44 to 30, essentially what would happen is you'd have a bit more free testosterone compared to your total amount. So you'd have more free. So that might give you a little bit more oomph potentially. I think ultimately people can sometimes overly sort of fixate on the SHBG. Really, ultimately, it's like, what's your free testosterone level? What are you feeling like? How are things going? I think SHBG low can be a problem if it goes very low. So kind of single digits, because just in practice, you tend to find guys whose SHBG is very low don't tend to feel as well. And that might be because it's not necessarily the SHBG. It might be the reason behind why it's so low. But yeah, I would say if you were to hover between, 50 and 30 or 25, you may get a little bit more out in terms of free testosterone, but I don't think necessarily it would necessarily be a massive game changer per se.
Okay. And what sort of things affect SHBG? Like what sort of lifestyle typically would raise it and what would lower it?
So in general, a lot of guys nowadays have lower SHBGs. And the reason for that is if you imagine sort of sedentary lifestyle, high sugar, basically metabolically unhealthy, that tends to lower your SHBG. The higher SHBGs, funnily enough, tend to be the athletic folk or the guys on low carb diets. That can, that's associated with an increase in SHBG. If you imagine it in a way, it's not quite how it works, but insulin lowers SHBG. So if you've got high insulin, so if you're diabetic type 2, or if you're insulin resistant, then your SHBG will often be down. If you're very athletic or low carbohydrate diet, often the SHBG will creep up. Then there's genetics involved in it, your liver health, hormones can have a knock-on effect on your SHBG. So like your thyroid, your testosterone has a knock-on effect on it as well. So different factors, but commonly low SHBG might be an overweight person, not very active. A higher SHBG might be a slim, low carb or very athletic person. Yeah.
Okay, so is it like the body trying to help those who might need it more? So, if you're sedentary, it's like, okay, you really need more free testosterone than the body is.
Yeah, you could say you could say like that in a sense, because it's almost like you're not going to be making much testosterone if you're living like that. So you're trying to free it up almost in a sense. You wonder if that was like an evolutionary thing, although that would be a recent event. Yeah.
Right. And you mentioned that freeing it up too much could it doesn't necessarily mean you're going to be feeling better. I'm always thinking about optimal range. I'm like, like when my test came back before from the hospital, I think my SHBG was on something like 53, and they were like, oh, it's in range. I'm like, that's terrible. How do I lower it? And the doctor was saying, oh, don't worry about trying to lower it. I was not happy. Now it's showing as 44. I'm like, okay. How do I lower it even more? Always. So I want to know, like, is there a disadvantage? Is there a benefit? I understand you don't want your test levels too high. So I'm like, okay, cool. But what about free testosterone? Is there too much free testosterone? What is the good range to be at? That's what I'm about. Like trying to optimize everything. And I'm sure most people would want that. You don't want to be chasing numbers, which is almost impossible, but you want to feel your best self. Do you know what I mean? So that's it, really.
Yeah.
Okay, what's these other ones? Free androgen.
Free androgen index. Yeah, it's a thing that the lab sends you. It's basically giving you a reference point to how much of your testosterone is free relative to how much the total is. So it kind of gives you a percentage score. I don't tend to use it too often. I tend to go off the actual raw values, really, rather than saying your free androgen index is this. So not something I tend to fixate on. At the bottom, you've got your full blood count there as well. So this is your red and white blood cells, hemoglobin, blood count. And then the second half of it essentially is your white blood cells there. You can see there, one thing we do keep an eye on, really have not very common to be causing a problem of any major concern, is your HCT when you're on testosterone. So that's essentially how thick your blood is with red blood cells. Because testosterone stimulates the production of red blood cells. So sometimes the hematocrit, which is basically concentration marker, can increase when you're on TRT. Yours is obviously lovely, nowhere near even highlighting as out of the normal range, to be honest. So that's perfect. The only thing you did clock was a slightly low lymphocyte count, which is a type of white blood cell that deals with viruses and things like that.
Okay.
Do you recall any sniffles, coughs, colds in the lead up to the blood work?
Not at all. Not
That stood out. Yeah.
No. Okay. Lymphocyte. Okay. So that would typically be what? Like a compromised immune system or something?
Well, with white blood cells, if it's a single result, so a single type of white blood cells, so the rest of the blood cells, the white blood cells are normal, you would say that that kind of mild one-off reading is very common in general public when they get their bloods done. And the reason being is even if you've not been ill, but you've been exposed to a virus or you've been exposed to a bug and your immune system has responded, it gets used up essentially is a way to think about it. So that one-off reading like that, see it really often, and it's not anything of any major alarm or concern. It's quite common, particularly when you're kind of getting your bloods done regularly, that you will occasionally pick up like a low lymphocytes or a high neutrophils or a low neutrophils, just because your immune system on a day-to-day basis, week to week, is having some work to do. So that is a kind of one-off reading with an isolated low level. It wouldn't hint at any concern or anything. And so it'd be one thing that, you know, you'd flick an eye to if when you get your bloods done again in 6 months or however frequent we look at, and you just have another look at it just to see, oh, is that back up now? And then you might find that maybe the eosinophils are slightly skewed next time, but yeah, it doesn't indicate a problem essentially.
All right. Okay. Cool. So back to the white cell count. It says 5.1. So that's what? Almost mid-range, probably slightly below mid-range. I'm not sure.
Yeah.
How would you say? So is 11 where like optimal, or are we? No.
Yeah. No. Essentially, with white blood cell counts, you can't necessarily kind of judge it based on the reference ranges to say this is optimal, this is not. You'd say, generally speaking, a panel like that would be considered very hunky-dory. When you're looking at immune system, sometimes the white blood cell counts can hint at certain things, or they can align with symptoms you're having. For example, sometimes if people have gut problems or allergy problems, it can show up in the white blood cell count. But in terms of sort of targeting tweaks for optimal, it doesn't quite work like that because they're so fluctuant depending day to day, week to week, that you'd more judge your immune system based on how often are you getting ill, what's your kind of duration when you are unwell, that sort of thing, rather than necessarily using the blood work there.
Okay. But what do those numbers represent exactly? What's a 3.0? Would it be concerning if I was more to a 3 or 11?
9. Well, you'd look at the breakdown, Roger. So you'd look at, say, what percentage makeup of that is the neutrophils, lymphocytes, monocytes.
Right.
You'd probably argue low white blood cells can be either or could be concerned if they're out of the range consistently, because they can indicate something's wrong with your like the total, I mean, not just an isolated one, the total, because it can indicate a problem with your kind of bone marrow, which is what makes your white blood cells. Yeah.
Okay. Interesting. Okie dokes.
You think that was I think overall good panel as such to go through as such. I hope I found that useful there.
I'm sure they did. There's a lot of useful information there, especially if a person decides they want to go on TRT, like if they are medically recommended to, they can see if there's any extreme measures, what it would show. And there's nothing really extreme on mine. Did we go into the LH? I'm not sure. FSH? Don't know if we did actually.
Yeah, so with your TRT, usually they don't tend to mean too much as such, because you're kind of on testosterone, so you expect them to be slightly suppressed like they were. Yeah.
I think that's the only thing really for people to know, that once you're on it, your natural production is going to be shut off. So what's your views on if somebody was to be on it? Is it a lifetime decision the moment you start? Can people decide, okay, I want to use it for a short period and try and get my natural production up, or try and periodically use it? I want to try it for a baby in a couple of years or something. What's your thoughts?
I think I essentially think if it works, it's best to be considered long term. So I kind of look at it as, you know, you can potentially. So some guys will come and they're not sure whether testosterone is going to make big changes, and we discuss it and we say this is the pros and cons, and maybe they take it for 3 months and they notice a real big change and they're going to stay on it. It is best to consider it a long-term commitment when you start the treatment. I don't think you should go on, off, because essentially, like you said, you're only getting the benefit of it when you take it. You're only getting the benefit of it when you're kind of using it. And if you're on it for a long time, because you've suppressed your own production, if you stop it, your own production will return, but it might not return to the level it was before you started because it's been switched off for a long time. And so I certainly I think the best way to think about it is potentially long term. Now, if you're early on and you say, actually, it's not made much of a difference, you've given it time to work, but it's not noticing too much, some guys will stop. But if you're you're well consulted on it, and you know the pros and cons, you know why we're looking at it, doing it, most guys will stay on it long term because it, like you said, it makes you feel a lot better and it helps how you feel day to day.
What about the guys who want to have children? The sperm count is going to get greatly reduced, isn't it? So what about those guys? Let's say they're suffering from low test, they're they're weak, and they've tried natural measures, it's not working, and they want to go on TRT, but they also want to have children in the future. What do you say to those guys?
I think it needs good planning, essentially. So for myself, I had my third child on TRT and essentially used other injections alongside my testosterone to stimulate my sperm production to increase, and it worked very well. But it is quite, it needs a good discussion over the options, because you want to know before you go on, ideally, that you are fertile. And then when you're on treatment, monitor your sperm count, and you can adjust the adjuncts, so the other agents you're using, to kind of get the sperm going again. Yeah.
Right. Okay. So
it's complicated, but it's usually managed. Yeah, exactly. Yeah.
Right. I was going to say Alphagenix, they prescribe TRT. Is there anything else that they prescribe alongside it, or is it, the things like, if guys want to have babies, or is something they do?
Yeah.
Okay.
That's what we look at. Yeah, absolutely.
That's awesome. Well, I think I've got everything I needed. Is there anything else you feel might be interesting to share, or?
I think we've covered a lot for us. Yeah. We can always have a chat down the line. If you get your old results for me as well, we can always compare and contrast them. Be happy to do that. Yeah, look at the trends.
Yeah, that would be interesting. Yeah, if I get a moment, then I'll definitely share it with you, and then we can see where the trends are at, whether there's been improvements or a slight decline somewhere, and see what we can dissect and piece together,
exactly
summarize.
Yeah.
Well,
lovely, Roger.
It's been an absolute pleasure, my friend.
You as well. Take care of yourself.
And you too. Goodbye.